Well, welcome everybody. Are we ready to go, Annette? Well, thanks so much for signing up for this. It's been uh, really cool working with the other two chambers in Franklin County and Cuyahoga County. I'm Mike Morosky, the Executive Director of the Human Services Chamber of Hamilton County. We were the second, and we're happy to see that Cuyahoga County, through Center for Community Solutions, has followed suit. And the idea was years ago, the executive director of the Franklin County Chamber, and in his stead, we have Bamika, who I know this is being recorded, but he wouldn't mind, is probably better to have than him anyway. But we were talking, wouldn't it be neat if someday, we could have the three most populous counties get together on statewide and or federal advocacy if the need ever arose? Well, the need arose. Annette got her job in December, and we really have just all dived in together, done a few statements together, and it's our first sort of event, so to speak. And Annette, kudos for putting it all together for us. And thanks again, everyone, for being here. I'm just going to kick it off the brief in case you don't know what a Human Services Chamber is. Essentially, think like a business chamber, but for our sector, our nonprofit sector. And if I may, this may be a personal side, but I believe 25 some years in this space, I think it's true. Our sector is known to do really, really good work, not necessarily always known to come with one voice with an ask. The business chambers across the country do that really well. You could contend that it's maybe easier that we have so many different voices and so many different populations, but it's important, especially now when there's so much chaos and confusion. And so the Human Services Chamber, broad brush, we seek to coalesce our issues, our varied missions, our varied budgetary sizes, social, political capital. It's a messy Venn diagram, as Annette and Bamika will tell you. But when we can meet and come as one, things tend to happen more quickly. Still not as quickly as we'd like, but that unified power in our voice is important, we think. And doing it in a statewide manner, our three chambers have called meetings with our senators, Houston Moreno. You get emails back a lot quicker. Again, doesn't mean things happen much more quickly, but you do get responses and I think attention. And that's important right now, probably more than ever. It's a misused phrase, but I think it's true. And so that's what we do. And we're happy to give a breakdown on what is largely bad news. Not to speak for Annette or Bamika, I'm not that dumb. But it's been hard consistently delivering not just bad, but almost it's terrible news to members. And so we've been trying to do our best to also provide bright spots and information when we can. So I think that covered it as best I could, Annette, and I'll kick it over to you.
Yeah, thanks, Mike. My name's Annette Yuamoto. I'm the director of the Cuyahoga Human Services Chamber. Like Mike mentioned, we just got started in December, but we were already at 90 members and continue to grow each week. In a few moments, we'll run through a number of areas of interest to the human service sector, including tax provisions impacting nonprofits, the child tax credit. Gina Wilt from Coalition on Homelessness and Housing in Ohio will be talking about housing supply and HUD. Brandy Davis from the Center for Community Solutions will be talking about Medicaid. Jory Novotny will be talking about SNAP. And Mike will be talking a little bit more about Affordable Care Act and immigration. We have Bhumika Patel here from the Human Service Chamber of Franklin County to share more about advocacy. After the presentations are done, we will stop the recording and answer additional questions as well. But feel free as things come up for you to ask them using the Q&A. We have Dylan from the Center for Community Solutions to respond to things in real time, and he can tag some of our presenters as well to answer the questions as we go along. The webinar recording and resources will be emailed to everyone after the presentation and available on a web page. And I just want to mention that today's topics are not an exhaustive list of everything being discussed in the federal budget reconciliation process that impacts the human services sector. We'd probably be here for a week if we were to do that. But these are some of the measures we know will have the greatest impact here in Ohio and that we've been talking to our members about. So as we get started, I just want to set the stage that currently the Senate has shared some of the tax bill language. It's headed to the Senate floor for a vote as early as next week. Because the Senate has made changes to the House passed version, The bill will have to be voted on again in the House. While Republicans can enact the tax bill with only a simple majority in the House and Senate, they have very slim margins, meaning Republicans can only afford to lose 3 votes in the Senate or House. And the leaders have stated that they have July 4th as a goal for passage of the legislation. Just wanting to move forward here to kick us off, talking a little bit about tax provisions that are impacting nonprofits within the bill. What was passed in the House and being discussed in the Senate includes several provisions that will directly impact the nonprofit sector. Both versions impose a 1% floor for the deduction for charitable contributions made by corporations and allow corporations to carry forward the tax benefit for 5 years. We encourage advocates to oppose this as it creates an artificial limitation on the incentive to give to charitable organizations. Also, both versions put a cap on the value of the charitable deduction for high-income taxpayers. The concern here is that this reduces the incentive for an amount of charitable giving to nonprofits, and thus we advocate that it be removed. The House version included a partial tax deduction of $150 for single and $300 for joint filers for charitable contributions for those that do not itemize on their tax returns through 2028. The Senate version makes it a permanent partial tax deduction of $1,000 for single and $2,000 for joint filers. This is positive as it would further incentivize charitable giving. At a high level, a few of the other items of note, both versions also increase taxes on college and university endowments, expand the 21% excise tax on nonprofits that exceed $1 million in compensation to any employee. The House included a provision increasing the tax rate on net investment assets to private foundations, which would reduce financial resources available to nonprofits given the amount of support we receive from philanthropy, but there is no such provision in the Senate. There was harmful language that was initially included in the House version that would have granted unprecedented authority to the executive branch to revoke nonprofit tax exempt status. But through the advocacy efforts that our Human Service Chambers joined in with many advocates across the country, this was actually removed before final passage and was not included in the Senate version. Additional analysis of these provisions these tax provisions impacting nonprofits is available from the National Council of Nonprofits. They literally just sent all this information out last night, and it's being shared in the chat, including templates on how to advocate on these issues. But overall, I do want to share that the nonprofits depend on donations to provide vital services in our communities. Therefore, we advocate that our legislators avoid changes that make it harder for people and companies to give. Right now, the bill would limit tax benefits for donations and disincentivize charitable giving. These changes would lead to less giving, and that means fewer resources for the people who need nonprofit services the most. We also advocate for keeping a deduction for people who don't itemize their taxes to help boost giving to nonprofits, ensuring that we have more support that we need to help our communities. Now I'm going to pivot a little bit into the child tax credit, which was created to assist families with financial costs of raising children. It's been around since 1997. Currently, the child tax credit helps families lower their federal income taxes by up to $2,000 for each child who qualifies. The amount starts to go down if a single parent makes over $200,000 or a married couple makes over $400,000. Part of the credit is refundable through the additional child tax credit. This year, families could receive up to $1,700 per child as a refund, but after this year, we would return to pre-2017 levels for the child tax credit. The House version would raise the child tax credit to $2,500 per child through 2028 before going back down to $2,000. Filer and spouse would be required to have their Social Security numbers. However, due to income thresholds, lower income families would get about half as much as upper income families. For example, low income families, those in the bottom 20% of earners, might only see a $350 increase per child compared to $800 for families that earn more. The Senate version has the child tax credit at $2,200 per child, so it's smaller, but it's indexed for inflation. The refundable portion beginning at $1,400 is made permanent and also indexed for inflation. The Social Security number requirements are stricter than the House version. by requiring work-eligible Social Security numbers for filer, spouse, and each child. I know Mike is going to talk a little bit more about immigration later on, but it could impact children who are citizens. And we'll again emphasize it a little bit more later on. But in summary, the House offers a bigger short-term boost through 2028, while the Senate provides a lower but inflation-adjusted credit starting in 2025, offering earlier long-term stability. Policy experts have shared in both versions the changes don't benefit our lowest earning families in our communities. And so definitely something we want to continue to watch and advocate for. And with that, I want to turn it over to Gina to start talking a little bit more about housing and the budget.
Thank you. Appreciate that information too, as we're all, nonprofits here and just really so important. Thank you so much, Annette. My name again is Gina Wilt. I'm the Advocacy Director here at Ohio Coalition on Homelessness and Housing in Ohio. We're a statewide advocacy organization, and our mission is to end homelessness and to promote affordable housing development, truly affordable housing. And we really believe that we can end homelessness in Ohio if we put the resources in the right places. And we want all Ohioans to be able to access safe, decent, accessible, and affordable housing. And we really believe that that everybody should have housing. We don't want to leave anyone behind. And that will so appreciate the opportunity to share some perspectives on the big, beautiful bill, act, or the reconciliation. I'm going to focus mostly on the housing supply provisions. This is the silver lining Mike was talking about, if we could find something positive. So this is the silver lining. So being the reconciliation bill, they do have some of these tax provisions included. And so we are hopeful and pleased with this portion of the reconciliation bill. So it does include a 12.5% increase and 9% for the 9% low-income housing tax credit. So LIHTC is what we call it. So for 3 years, and it does lower the threshold for bond finance development deals. So more projects would be eligible. 30% basis boost for the rural areas and tribal areas, which is huge for Ohio. So just having more financial feasibility for LIHTC in Ohio means Southeast Ohio, the Appalachian region, Mansfield, Marion, Lancaster, Portsmouth, those areas of the state could be served in a better way. So that's a positive. This also, the threshold and the increases also could accelerate just overall new affordable housing construction. And it really these are more tools in the toolkit for developers to get, incentives to get them to come to Ohio and do work, especially our nonprofit and mission-driven developers who we want here, building affordable housing. So all very positive. Of course, the devil's going to be in the details. And when we talk about affordable housing, Ohio will be working very hard to make sure that it is actually affordable housing. The question's always affordable to who? Whom is this affordable to? So really making sure we're targeting those extremely low income populations, those very low income populations, just in the extremely low income neighborhood for our ELI population, we have a shortage of like 260,000 homes in Ohio. So just in that space. So really happy that we have these opportunities for close to 500,000 affordable homes, of course, throughout the country, but that will be a positive impact in Ohio. The key gaps, which I did not put on here, but obviously these are huge gaps, is there's no provisions in this bill for rental subsidies. There's nothing in here for homeless services, or fair housing work, which is very important. We're not thinking about the chronically homeless populations. There's no support there. And it is a supply side. I mean, this is a tax supply type of bill typically, but of course there's no like tenant-based supportive services resources in this bill. So, but yes, this LIHTC language, definitely improvement. Certainly we stand in solidarity with and in coalition with all of our health and human service partners, because everything's connected. We say that housing is healthcare. And if we're, cutting, I don't know, $500 billion in social service safety nets, then this work is just not going to be productive. So we know everything is connected. So we hear a lot about pay now or pay later, invest now or pay later. And I feel like it's like what happens when you completely disinvest and all of the resources you put towards that investment, and now we're just disinvesting. It's almost like we are wasting money that we've already invested in. And we certainly don't want to disinvest in people. So I think in the next slide, I just put, and I know you guys are going to talk about this a little bit more, some of the dates that are out there, right? Well, we know the U.S., obviously the House passed their version. The U.S. Senate released their version. And I think it is really critical that to understand that there is still time. There is still a little bit of time here. There is still a little bit of opportunity to make our voices heard. I feel like when our policymakers and leaders hear from their constituents, they are shifting. So we are seeing that, like when they hear us loud and clear, we are seeing shift in perspectives. And so you have a very powerful voice, and Ohio is still a super important state, so which makes it even more critical that we are doing the outreach. And I'm hearing even from some of our U.S. Senate staffers that they're getting nervous because they're getting all of this pressure, and they're getting all these calls, and they are having those conversations with their bosses, so with their member. So yeah, and you talked about the razor thin margins, and with all of the different dynamics, like the Senate is increasing the debt ceiling. So I think that's interesting. So I think we could lose some people for that purpose, but then we'll also maybe lose people like a Susan Collins, who is a moderate Republican, for other reasons. So I feel like there's just, it's a little messy, a little chaotic, but there might be some opportunities to come in when there's all these moving pieces to make sure that our voices are heard. And then on the next slide, I think outside of reconciliation, thought I would give a quick update on some of the HUD staffing cuts. They are starting to try to rehire people, which is interesting. So people, they said, we don't want you anymore, we're cutting, but now they're saying, oh, we're going to start rehiring, which costs more money. But right now we're seeing about a 25 to 30% staffing cut. And a lot of those were, people who decided to go into early retirement. But it's really hard for the HUD field directors when you only have so many, and we've lost so many. And so a HUD field director might be covering 2 or 3 different sections now, where they had their one district, and now they're covering like 2 or 3. So it's been a really tough time for people just to get things done, because there's just no capacity. But hopefully things are getting better, knock on wood. And then the next slide is just a quick note on the skinny budget, which is different than the reconciliation. So the skinny budget is the regular appropriations bill. We could say, the president obviously put out his language, but that is not the be all end all. Of course, Congress has the Congress has, they're the ones in charge. So with putting this really truly together. So my big advice here is just to start getting prepared, start watching, get prepared, be ready, as Congress starts to put together their version of the appropriations bill. That if what we're doing is we're trying to put together very simple, quick bullets, just very, very simple, very concise, numbers and cents in a way that anybody can understand the need, and then stories, having, a story bank, like why this is important. So, looking at the skinny budget, they're trying to cut HUD by like almost 50%, like 44% cut in some areas, 48% cut in other areas. So almost a 50% cut to HUD. So what does that mean? What would that mean? So hopefully Congress will not cut as bad as the skinny budget numbers put out there, but just putting together your stories, illustrating things in a way that really hit home with your policymakers. Like, this is your, could be your brother, this could be your sister, your mom, your daughter, in a way that it's relatable to them. So really trying to do that right now, just to be ready. We'll get through reconciliation first, but then we really do want to be ready and start preparing for the appropes. And I think that might be all. Hopefully that was what you're looking for, Annette, and look forward to answering any questions, and just really appreciate you including housing as a part of the conversation.
Yeah, thanks so much, Gina. From here, we're going to pass it over to Brandy Davis to talk to us about Medicaid.
Thanks so much, Annette. My name is Brandy Davis. I'm a fellow in Medicaid policy at the Center for Community Solutions. And Medicaid is a big part of reconciliation. So this is a little bit about who we are at the Center for Community Solutions for those of you who may not be as familiar. I'll leave that with you. Next slide. And this is what we do. We help make connections between people and organizations, and we work to improve community conditions and the quality of life for all of Ohioans. And we have offices in both Cleveland and Columbus, actually, just to make sure that we can make that happen. So our priority areas include Medicaid, but we actually have 5 priority areas. And so we'll just touch on Medicaid today, but here's just a little bit about our 5 priority areas at the Center for Community Solutions. So today we're going to talk about a little bit of like what's going on with Medicaid in Ohio. What are the threats facing Medicaid, the Medicaid program in Ohio in particular? And we might touch a little bit about like what can we do to sort of change those things and do as advocates. So I just want to do a little bit of level setting. So of course, Medicaid is a joint federal-state partnership. And so we're going to talk a little bit about federal medical assistance percentage. And that's just essentially the match rate that comes from the federal government. And we'll dig deep into that a little bit more, but that's just, we refer to that as FMAP. And so of course, the federal government sends down these dollars, and the program is administered through the Ohio Department of Medicaid. So the policy changes that we're going to talk about within the budget are work requirements, FMAP reductions, which is a question mark, and we'll dig into that a little bit more. And then also just some indirect costs for states and localities. We'll touch on that. Populations at risk. This is really important because some of the populations that are currently at risk in Ohio in particular are rural populations. We see some Appalachian populations currently at risk. According to the Center on Budget, we can see that 11 hospitals, rural hospitals in Ohio, will be impacted. And obviously, because they have more Medicaid populations that they serve, if there are some reductions to the Medicaid populations that are receiving services or receiving their health insurance rather through Medicaid, when hospitals are serving more Medicaid or higher Medicaid populations in those rural communities, they will greatly be impacted, and we'll talk about that. So one of the things is work requirements. So we, in the current budget, federally at the House level, there were work requirements that were sort of deeming folks, okay, like you're ineligible based on just like general parents were preempted. But in the Senate version, we see that children who are 14 years old and younger, in the current Senate version, so though they're parents of children who are 14 years old or younger, would no longer be exempted. And nationally, the Congressional Budget Office saying that that could be about 5.2 million adults who would no longer be exempted from the work requirement waiver. And so that's like a big deal. We know that nationally, this would put just implementing this would put 100,000 to 400,000 additional people at risk of losing coverage. And so we also know that more than 90% of adults enrolled in Medicaid either work full-time or they meet exemption criteria laid out in the current proposal. But what we're looking at is that those paperwork issues. So next slide. And so the expansion population, which is up to 138% of the federal poverty level, which is $21,597 for an individual in 2025. And what I've been telling folks is, these are your managers at the grocery stores. These are the folks that you use. These are people who were deemed necessary during the COVID pandemic and had to go to work. They are, for an individual or a family of one, a household of one, they're making this amount of money, and they would no longer be able to qualify. They would have to adhere to these Medicaid work requirements, which means turning in this paperwork, really making sure, and in addition, so at the federal level, there has been at least some funding that's been provided to implement Medicaid work requirements. But at our state level, there's not been additional funding that's been appropriated. And so when we look to people who are processing applications within our counties, we've got to figure out how to allocate staff, how to process that paperwork that's going to have those, what I've been calling unintended consequences, which may actually be intended, but it will not just affect people who are subject to these work requirements. So we know that, like, and when we're looking at this, we're talking about that FMAP, which is just the federal match. When we're looking at the federal match and then this expansion population, it is a 90% federal match. All right, for adults covered up to 138%. We're talking about these able-bodied working adults up to 138% of the federal poverty level, right? And so for those adults, when we're looking at that expansion population, it's a 90% federal match. And that pays for 90% of costs, which is a great deal. 90% of costs from the federal government coming to the state. And I got a question mark for that FMAP because we've been looking into some things with some immigrant populations, and we're sort of making some decisions through analysis on what that means for certain immigrant populations. Next slide. So I'm going to answer the questions. I think, Annette, are we answering the questions at the end, or do you want me to jump in now?
I think up to you if it makes sense now.
Okay.
Until the end.
So any changes to the implementation timeline for the work requirement in the Senate proposal? No. So like there aren't any. So the thing about it too is, well, there's like some date changes, and I can be specific about that later on. But when we look at, so we're comparing sort of the federal budget with our state budget, and our state budget has been happening as our state budget generally happens. And it hasn't necessarily been incorporating things that are changing in the federal budget, which could pose some challenges. But I can answer this in more detail later on. So when we're looking at our Medicaid funding and that FMAP that I talked about, which again is just that federal match, we see that states with a lower per capita income, they may receive so there's a federal match for traditional Medicaid, and there's a federal match for the expansion population. We talked about how the expansion population was up to 138% of the federal poverty level. And then traditional Medicaid, that federal match is around like right at, it's like a little bit over 65%. So which is again still a good deal. That's a lot of a match. But we see under the ACA, those adults could be in jeopardy when we're talking about some other considerations that we're still figuring out relative to the immigrant population. Next slide. So when we look at like who would be impacted by these supports, I spoke a little bit about rural hospitals, and I want to dig a little bit deeper into that too. So rural hospitals would greatly be impacted because we know that like they're generally the service provider or health insurance coverage provider for rural hospitals a lot of times tends to be Medicaid. We know Medicaid covers nearly 50% of births in Ohio. And so when we look at like the rural populations and what that would mean, we're essentially shifting costs to states. So people are going to have to make some decisions. And while we're also shifting costs to states, we have another source of funding, which I won't really dive into in this conversation, but another source of funding, or two different sources of funding that are going directly to hospitals that will also be reduced in this, one because of this budget bill, and the other because of the Patient Protection Affordable Care Act, with the assumption that we would have healthier individuals enrolled in coverage. So we wouldn't need this, right? We wouldn't need everyone to rely on Medicaid. We wouldn't need sicker individuals to participate in the marketplace. But that didn't happen. We no longer have the individual mandate. It was ruled unconstitutional. We know years later things have changed. And so having an FMAP drop it would have economic consequences, not just for individuals, but also like local economies. So what we know regarding Medicaid and work requirements is that more than 90% of adults who are enrolled in Medicaid either work full-time or they're meeting the exemption criteria laid out in the proposal, like having a disability or caregiving. But that doesn't necessarily mean they won't lose coverage here. Because again, we talked about that processing and what it means, having to process a lot of paperwork, et cetera. But we know that people are working. So it's just increasing bureaucracy that's sort of unnecessary. And when we look at like sort of research and real world experience, we know that work requirements don't help people find or maintain work. We can look at Georgia Pathways to illustrate that. It's a great illustration of this. And we also know that in large numbers, they result in people actually losing coverage. And many of the people who lose coverage are working or should have been exempt. But because they had to turn in a certain amount of paperwork, proving their work hours, et cetera, or their exemption status, they ultimately end up losing coverage anyway. So when we look at the, thank you. So when we look at the Senate bill's work requirement proposal, it applies to adults who are 19 to 64, who are enrolled in the Medicaid expansion, ACA Medicaid expansion. It's mandatory for all states and it'll go into effect on January 1st, 2027. Unless a state seeks and the Health and Human Services Secretary grants a temporary exemption to delay the implementation. So that's important. You could delay the implementation for 2 years. So this is a moment for advocacy. When we're talking about stakeholder engagement and things, these work requirement waivers can be delayed for 2 years as it relates to the current rules in the budget. Next. So one of the things we've really been working on is just sort of expanding support services. We want to keep what we have, but also provide additional support services such as transportation, like along the continuum that we've already been providing as it relates to Medicaid. And this just can really help like sort of mitigate some of the challenges that are posed by some of these things like work requirement waivers. And one of the things also I want to touch on is that the Ohio Department of Medicaid has submitted a work requirement waiver, a Section 1115 work requirement waiver. And then also, so states can enact work requirement waivers sooner, according to what is currently in the budget, sooner than the date that is proposed for these mandatory work requirement waivers in the budget as it moves forward. But of how we can mobilize and respond. Next slide. And Darlene, to answer your question, if we want to go back, can we go back a little bit? Here's just our advocacy. Oh, no, just advocacy. Here's just our advocacy and response. Like, this is what we're looking towards. And this is what we can do. Like, I know that we're currently like in the Senate, but we can make some amendments. And then also like we can make some changes. So like just sort of looking at getting connected and making sure that we can sort of influence calling your senators really right now and really discussing how this will impact you personally, your family personally, your community members personally. Is really important at this point in time. All right, and I think the next slide should just be my any questions or anything, but we can do that at the end if you want. And here's my contact information. Thanks so much, Annette.
Thank you, Brandy. And now we're going to transition into SNAP. Up some references here, and we'll be sharing these resources with everyone. But want to turn it over to Jory to talk a little bit more about SNAP.
Thanks so much. So we're all here talking about reconciliation. Thanks for having me. I'm Jory with the Ohio Association of Food Banks. I'll start just by giving you a brief overview of our network and why we care about SNAP. We represent the statewide hunger relief network, our 12 food banks and their 3,600 local hunger relief providers, many of whom are entirely volunteer run, who bring in donated and privately purchased products in addition to federal and state commodities to make sure that people who fall through the cracks of other safety nets have some basic food to rely on. Next slide. This is just a quick map of all of our food banks. And on the next few slides, I just wanted to kind of give you a background on why we exist. We were created by our member food banks when they recognized that there were growing gaps in safety nets and that they needed to have a unified voice at the state and federal level, which we've been using on their behalf and on behalf of Ohioans facing hunger ever since. In the aftermath of welfare reform in the mid-90s, we saw, immediate crippling of access to basic needs and help with basic needs. And in many ways, in terms of SNAP and other priorities that my colleagues are presenting on today, what we're facing in this potential budget reconciliation process would be even more significant than what we experienced in the wake of welfare reform. So on the next slide, just a reminder, food banks are multi-county, multi-service organizations with large warehouses. We move in and out millions of pounds of food each year and supply that food to local food pantries, soup kitchens, shelters, and other feeding sites in all of Ohio's 88 counties. We exist on the next slide. And we're a critical part of the food supply chain. We're designed to make sure that food doesn't end up in landfills, but instead can be enjoyed. We're supposed to be a safety net to the safety net. We should not be a first line safety net, but we're there to catch folks that fall through other gaps. And of course, we want to promote equitable access to wholesome, nourishing food. We source food in a variety of ways in partnership with state and federal government, but we pale in comparison to the impact that SNAP makes, the Supplemental Nutrition Assistance Program, which is what I'm here to talk to you about today. On the next slide, I'll dive right into, well, let's go ahead to the next slide. Thank you. That's perfect. I'm going to talk about the House version as it relates to SNAP and then the Senate version. And I'm going to spend a lot of time talking about the things that not only are we most concerned about, but also that are most likely to resonate with Ohio's congressional delegation in your messaging as advocates. The House's version of budget reconciliation would structurally change SNAP. SNAP is designed to respond cyclically in economic downturns. So when more people experience periodic unemployment, they can go and get temporary assistance from SNAP. There are already time limits tied to work participation within the SNAP program. Those have long existed, and Ohio has not largely sought waivers for the most part to those work requirements for over a decade. So we already have time limits, but when a worker has been recently unemployed, they should be able to go and turn to SNAP for some temporary help while they seek out new employment. The vast majority of people who are poor enough to qualify for SNAP and who count on it to make up some of what they need to put food on the table are seniors, disabled Ohioans, families with kids. So we already have very little wiggle room to spare when it comes to SNAP, but the House's version would structurally change SNAP as we know it. SNAP benefits have always been fully federally funded. This proposal would force states to pay for at least 5% and up to 25% of the cost of the benefits themselves. They would also have to pay a larger share of operating costs for the program. States traditionally pay 50%, and the federal government matches that dollar for dollar. We've already seen, and I'm sure many of you are very familiar with the pressure on our county systems, on the lack of access to the benefits call center here in Ohio, with an additional reduction in investment at the federal level. The state is highly unlikely to be able to come up with additional operating support for the program, which would likely mean less investments in operational costs as a whole. Additionally, the budget reconciliation package would expand work requirements or time limits to more households. So I know Brandy already talked about this in relation to Medicaid. The House's version is different than the Senate version, and I don't want to spend too much time in the weeds on that, because I think what's important is that expanding those time limits affect the entirety of the caseload in terms of their ability to access the program, given again that we already have incredible access issues for all of the SNAP caseload. For our workers who are often, our low-wage workers who are often in transient employment, who are cobbling together some part-time work, who aren't salaried but are hourly and will see changes to their wages from week to week. All of these work reporting requirements are very cumbersome and really are antithetical to our goals as a state to increase work participation and employment. But I want to spend the rest of our conversation on the differences here in the bill. So, one more thing I should make sure to note, it also would freeze increases to what's called the Thrifty Food Plan, which is used to set the formula for determining what it costs a family to buy the most basic amount of foods. And SNAP is a very complex program to determine eligibility for. This would just make it more complicated to determine eligibility and then restrict the ability for adjustments to the cost of food. So as food costs have accelerated significantly over the past several years. In fact, we saw a 24% increase in the All Food Consumer Price Index from 2020 to 2024. The formula that the federal government uses to subsequently adjust SNAP benefits to acknowledge the increased cost of food, that would go away. Ending in total in hundreds of billions of dollars in cuts to SNAP. Next slide. So in the House version, based on the state's current error rate, Ohio would be responsible for close to $500 million in the first year of implementation, and responsible for likely at least that much every year going forward. What's important to note is that this would really come at both sides. So it would also fundamentally change how the federal government calculates the error rate. Error rates are not fraud rates. They are reflections of potential clerical or administrative errors. And this package would make any error, even as low as $1, factored into the error rate. There's currently a sort of low threshold where manual or clerical errors are ignored in that formula. This would inevitably increase state error rates, thus increasing the state's share of their required cost share. So for the state to come up with about $70 million more in operating costs for the program, as well as almost $500 million in benefits, will have ripple effects that I'll talk about more ahead. Next slide. Thank you. The Senate Agriculture Committee did release its initial draft of bill text. It I don't suggest you use this messaging because it still structurally changes SNAP and risks the continuation of this federal nutrition assistance program. You may hear from Senate offices that the proposal has been moderated in their version, and this is what that means. They've slightly reduced the cost share for the state. They're giving states a chance to avoid a cost share if they keep their error rate low enough. But with those other components I talked about, it's highly unlikely that states are going to be able to avoid a cost share. It would still mean hundreds of millions of dollars in the state's burden on the cost share. It would still increase the operating threshold, and it still expands time limits and those work reporting requirements. So the expansions are up to 6, both in the House and the Senate. It would increase from age 59, which is where we're moving toward now incrementally, all the way up to 64. So this would add work reporting requirements for workers who are, at the point of aging out of the workforce and are likely to experience age-related workplace discrimination. Additionally, the House version would require work reporting for parents with kids 7 and older. The Senate version, it has increased that to 10 and older, and there are some rumors that they might bring that up to match the Medicaid work requirements that Brandy talked about. So that's a little bit in flux. I think important to just, from a messaging perspective, focus on this taking food from kids. It will do that. Both by reducing the adjustments to the Thrifty Food Plan going forward, and also by threatening the underlying promise of a SNAP program in its entirety. So I want to focus there in the time I have left with you. Next slide. So that we're all on the same page about what SNAP is capable of now and what it isn't capable of already. We talked to 2,300 food bank visitors across the state about a year ago, and we asked them why they were coming to us. Next slide, you can see some of the trade-offs and coping strategies they told us that they're making already. Roughly half of the folks that turn to us are able to participate in SNAP. But the other half aren't poor enough to qualify for SNAP or have not been able to make it through the application eligibility process, so only have our network to turn to. So they're already making really tough trade-offs regularly. Next slide. And what's important to note is that SNAP benefits are already grossly inadequate. For most folks receiving SNAP benefits, they exhaust those benefits in the first half of the month, and a third reported that their benefits last just 1 week or less. A reminder that the minimum benefit is $23 a month, and we have tens of thousands of seniors that receive just $23 a month already from SNAP. So it doesn't do everything for families, but it's critically important, and we certainly can't risk sacrificing more investments in this nutrition safety net. Next slide. So you as, state level advocates, I know many of you are, just to kind of underscore the ripple effects that this could have on state budgets, on local governments, and on our local economies. To meet their cost share, states will either have to raise revenue, cut other spending. They can try to reduce the number of people who are eligible for SNAP or participating in it. They'd have to be pretty drastic to be able to do that because there's no room to give in the populations that are already eligible for SNAP, or they could refuse to meet their required cost share in order to have a program. States may decide that they can't afford the cost share, and we haven't really been able to get clarity about whether or not states will be able to opt out of the program entirely if they can't or choose not to meet that cost share. We know that rural grocery stores, and similarly to rural hospitals, as Brandy talked about, operate on much slimmer margins and rely on a healthy amount of their revenue coming from SNAP customers. So if you're a customer, regardless of whether you're buying with SNAP or your own dollars, shopping in a rural area, you may risk your grocery store closing because they don't have any room to give in their revenue streams should they see these reductions occur, reducing access to healthy food for everyone. As I talked about, SNAP is cyclical. So when we see economic downturns happen, the state is bringing in reduced tax receipts. And at the same time, they would need to respond in greater amounts by increasing their investment in SNAP benefits for people who are impacted by that economic downturn. That's going to be really difficult for a state to chew off. We all know how state budgets work. Ohio is forecasting its budget for the next 2 years and going to ink it in a couple of weeks. Very difficult to see how states would be able to plan for what's unknown about the program ahead, be able to make sure that they have the revenue required to meet their ongoing cost share requirements, especially because the cost share is tied to error rates, which are delayed. It takes a while for the federal government to calculate the error rate. So it's just a really unimaginable task for states to chew off. And of course, as I talked about, children and seniors are going to be the ones who are most impacted by other proposals in reconciliation. Next slides. So I know I'm pretty much at time, but I just wanted to give you a chance to see some ways that you can get involved. On the next slide, we have a couple of QR codes you're welcome to scan, and I will also drop some links in the chat so you have them. If you're not already connected, I really encourage you to go and read some more from the Center on Budget and Policy Priorities about what's currently at stake. On the next slide, would also encourage you to make sure that if you're traditionally a healthcare advocate and you're traditionally talking about Medicaid, include SNAP in your messaging as well. If you're traditionally a SNAP advocate or an anti-hunger advocate, include Medicaid in your messaging as well. What we've seen in polling is that we can talk about $300 billion in SNAP cuts. We can talk about $800 billion in Medicaid cuts. And folks have answers sort of to either of those, but when we combine them and talk about over $1 trillion in cuts to the social safety net and to basic needs programs, it really makes an impact and drives home how devastating this will be for Ohio communities. On the next slide, what I just said with you is underlined here at the bottom. We're happy to be a resource as we move forward. As the other speakers mentioned, the Senate will need to get its version done, and then both sides will have to come together. And there's a lot of daylight between some of these proposals that we hope we can take advantage of and make sure that it gives us more of an opportunity to engage in the process that's been, really rushed up to this point. Want to thank everyone, all the organizations that joined our sign-on letter. We just sent a sign-on letter, an organizational sign-on letter this week to the Senate offices, urging them to say no to these drastic structural cuts and changes to SNAP. And we'll keep looking for opportunities to drive that message home.
Thank you so much. I know Mike is going to take over here, so I'm going to stop sharing my screen so he can really just control the conversation for a little bit here.
Well, thank you. Let's all just take a breath. I don't know about you all, but in the green room before this, I was talking that Annette and Bamika at Franklin County Human Services Chamber and I, the past few months have largely been delivering terrible news. And as strong as we are and as good at advocates as everyone on this call is, I know it's hard, so take a breath. You're good people. I know you are. I can't see you, but I know everybody here is a good person. And I've just started getting good at admitting to myself how difficult this is. That's a lot of heavy news, and I'm just going to add to it. I have a few editorial comments. Annette knows. I get the microphone. Just a couple, though. Gina struck a chord with me when she talks about the truly affordable. One thing we've started doing in Hamilton County in Southwest Ohio. So housing is one of our 7 priorities. It's where, on our big messy Venn diagrams, we all coalesce. It's hard. We're a few dozen thousand units short in Hamilton County. And when you talk to elected leaders, I say this with great respect, being a recovering elected person. I did 2 terms on the public school board in Cincinnati, so you can't scare me. Yeah, elected folks are not experts at much. And I, again, said with great humility, I'm certainly not. They might be an expert at one thing that got them to the point they were in their career when they ran for office. So it's important to remember, and I bring that up in the context of housing, is one thing I've started doing in conversations with housing that helps at the state level too, is whenever anybody says AMI, I ask them what the number is. And 9 times out of 10, they don't know. And I don't say it to be gotcha. I say it to advocates. They're the same, the same people on the street saying, well, we need this AMI. I go, what is that? What's that number? And until we start using real numbers in that conversation, it's just easy to, shuffle. So I just wanted to add that. And thank you, Gina, for all your work. I worked with Amy Rigel over there at Cuyahoga in a former life when she was at CareSource. And I know you all have awesome leadership with you, her, and everyone else. So thank you. And then the HUD piece, it's been difficult for us. How do you carry on business as usual now? Going to state and counties, the county here is looking at $500,000 in potential cuts. How do you carry on? And one thing we've elected to do is really get close with Cincinnati Metropolitan Housing, CMHA, who gets the HUD funding here, and advocate for that, because in addition to the money, and I'm not going to bring this up because we don't have time and it's already hard enough, and Gina knows this, if any of the changes, we talked about money today, if any of the changes they're talking about at HUD take place, it would be an immediate uptick in homelessness. And so the punchline, the way I see it is, and I think there's some of my members on this call, good to see you, even though I can't. The punchline of all this is, and when I talk to business leaders, et cetera, is, these proposed changes are without question going to increase the demand for services from the government and from the social benefit sector, us, who are, in my highly biased yet I think professional opinion, part and parcel of the basic services all of us take for granted, myself very much included. And you chip away too much at us, it's going to be hard for Ready Cincinnati, Ohio means jobs, et cetera, to bring employed. No one's going to want to be in Hamilton County. And so we've been really focused on HUD, working closely with our CEO at CMHA. And I just kind of wanted to add those as a sort of entree into my bit. And so again, I'm Mike Morosky, the Executive Director of the Human Services Chamber of Hamilton County. I'm just going to touch super briefly. Where's my Medicaid friend? There she is. Thank you for that. Medicaid is one of the most complicated things in the world, and thank you for that breakdown. There's so much. And this is related in some ways to the Medicaid piece, but in the Senate reconciliation, there's proposed to take away the premium tax credit, which is a refundable tax credit that helps eligible individuals and families afford the health insurance purchased through the marketplace. So in addition, I'm not going to say much more than that, if that's okay. I mean, in addition to all that, the insult to injury then is the few bucks, which are not a few bucks, are meaningful bucks to these families. You don't get that either. And so you're going to have a lot of sick folks. And the emergency rooms, the way I understand it from our community liaisons at the 5 hospital networks down here in Southwest Ohio, are full perpetually now. So that's all I'll say about that, but then I'll spend some time on the immigration piece. And, to point the finger at myself, I knew nothing about immigration until 2 years ago, except that I thought it was an important issue and that it was complicated. And thankfully, like the people I can see on the screen, I'm the lucky guy who gets to hang out with the experts in all of these various fields. So I've learned a lot from working with Immigration Refugee Law Center, Catholic Charities, Community Action Agency, et cetera, the past couple of years about immigration and just how complicated it is. We've had a lot of meetings lately with elected folks, and we're going to be meeting Monday with Senator Moreno and Houston's offices again. When we spoke to them the last time, they said a lot of things that jived with us, and then this happened, and maybe they changed their mind, or I don't know. We didn't get accurate information, but the leaders in that committee intend to ask those hard questions on Monday. I'll report back. I'm happy to say that the business chamber down here just recently joined our chamber, and we have reciprocity, and it's powerful in that their immigration collective, it's called Cincinnati Compass, will be attending with us. And I think that's strong. Now, what will come of it, we'll see. But they'll be attending with us. But before I dive into the pieces of immigration, I want to point out a couple things. And you may know this, so I don't want to insult your intelligence. First, 100% of Ohio's population growth last year was immigrants. 100%. It's not an exaggeration. It's a very real number, 100%. One thing, some folks, I certainly didn't know this until Myra Casas-Jackson, one of my board members, who's the executive director at the Immigration Refugee Law Center, taught me is, one government group that doesn't care about your immigration status, the IRS. They could care less how you got here, what you do, they're going to take your money. So regardless of your status, you are paying money to support, again, basic services that we all take for granted. Even the people who support these cuts, their basic services. And so I think this is a powerful slide that Myra put together and said I could use. So this is from Immigration Refugee Law Center. Those are big numbers. And then more locally, I don't have all of your municipalities in like Cleveland, Columbus, and I certainly don't know everyone on the call, but I know you're from all over the state. This is just in our region. And I'll leave that just for a minute. And I can say with pretty good certainty, it's probably similar with Cleveland and Columbus, knowing the population there. So that's the starting point of this bit of conversation. 100% population growth and those pretty stark tax numbers. So what was proposed? There were a number of things proposed in this reconciliation regarding Medicaid, Medicare, and financial aid. And everybody in some way has like touched on the immigration piece. So I'm just going to I'll be direct here and I'm going to be looking at my notes because it's a lot. And like I said, I'm no expert, but I know the experts and I know how to get the information. So the bill proposes restricting Medicaid eligibility, which we've heard a bit about, for certain immigrants, including those who have been granted humanitarian protections, like refugees, asylees, and survivors of domestic abuse. So this is sort of a new low, if I may, of sort of draconian policies that hearing Jory referenced welfare, the new speak welfare reform, and this being worse. And you're right, is hard to hear. But stuff like this, it just this feel, if I may, feels a little different too. And I'm going to quote our CEO of Catholic Charities down here. He said it best, like, regardless of what you think about immigration, going after agencies that are just trying to help people seems wrong. And how can we work together in that paradigm? And so let us help folks. We can't if you're taking away things from people who have struggled so much to be here, who would rather walk from South America to Ohio than stay in their home. It would also reduce federal funding for states to provide Medicaid to these groups. Lastly, broadly speaking, includes a penalty for states to provide comprehensive health coverage. And this is the piece I know we'll bring up on Monday, this piece of, okay, Senator Moreno, he said, regardless of where you are, it seems a bit far to punish people who are just trying to help those who are paying taxes in their state, municipality, et cetera. Medicare, the bill restricts eligibility to U.S. citizens, green card holders, certain Cuban immigrants, and individuals residing under, and this I had to look up. If you can tell me who the compacts of free association are, it's 3 islands that are within our jurisdiction, so to speak, and so they would still be eligible. The bill may trigger future cuts to Medicare as well, and it restricts access for legal immigrants age 65 and older who don't have the required work history, which we've talked about a little bit already. The last piece I would cover is the financial aid, restricting Pell Grant eligibility for students, also including provisions that would cut off some humanitarian arrivals from access to federal student financial aid. The impact, of course, of all this will increase the number of uninsured individuals, could also impact the broader economy and workforce, if I may, will impact the broader economy and workforce. And disproportionately affect dual eligible individuals by delaying or preventing implementation of rules that streamline their enrollment. So all in all, my board chair, who I believe is on the call, Dimity Orlett, who's the CEO of Pro Seniors, we have a weekly call, and we were just talking this morning. It wasn't even this issue, but it applies to all of this. Is these people aren't going to go anywhere. they're still going to be here. And, what exactly are we going to do? And, your brain can go to some dark places there, right? We don't, so asking our elected leaders that question, that directly, I think is important. So what is the plan? Here's the numbers. All right, okay, go ahead and do, so what, but then what? And if there's not a plan, we should probably talk about one. So that's my piece. And the last thing I would add, and I know we're going to dovetail into advocacy at some point, and I'm going to swing this over to state stuff here in a second, is I think it's also important, the $1 trillion numbers and all that, they are dramatic. One thing I have found when talking with philanthropy or elected folks, talking about public dollars, is I think it's important, and I think I can say on behalf of our chamber that our chamber feels it's important to start with, we know you don't have the money. A fun fact, if you took every penny in every community and private foundation in the entire country and put it in a pot, it would cover 74 days of the federal grant budget. So that's also something these elected folks need to know. Point is, we know that the money doesn't exist to fill the gaps that could potentially be created. And so, A, you need to ensure that you don't create higher demand for the services we provide. Or B, quit messing with us. But both is not, it's just not sustainable. It's not. And I'm going to be sending you, or I won't be, but Ebony will be sending some things on behalf of our chamber that we've produced about economic impact. Feel free to use it. Jory and I actually talked about it almost a year ago now, I think. But so I won't get into that. You'll see it. But moving into the state, I mean, having been a lobbyist for Children's Hospital and getting pretty familiar with our state government, it was hard before, but there were always avenues to get things done. And it seems exceptionally difficult now. These changes at the federal level, combined with ones like trigger language in Ohio of cutting Medicaid, could be devastating for the economy, for every area, rural, urban, it doesn't matter. This could be bad. It could be bad. And so I think, keeping an eye on both. Our chamber, it's been difficult to figure out where are we going to put our weight. We can't do it all, certainly locally, but our local governments are getting whacked too. So we're spending a lot more time at the state level, and thankfully Annette and Michael and Bamika, our chambers together have been pretty strong, I think, in that advocacy. But it's almost like constant waiting for the other shoe to drop. And I know Ohio doesn't need me to say that, but it's going to happen next. But these changes, especially the Medicaid piece, could be really bad for our state. And I'll kick it over to the state folks for that bit.
Thanks, Mike. I think we're going to have Bamika take over here. I'm going to bring up the slideshow here again. And go ahead, Bamika, take it away.
All right. Thank you so much to all of our speakers today and to everyone who has shown up for today's webinar and presentation. This is an old slide deck. You can kind of see it says May, but a lot of the content I think is still really relevant. If you want to kind of move on to the next slide, I think keep moving on a couple of slides actually. Keep going to like slide like 9, if it's okay. There we go. Nonprofit advocacy. I know everyone who is participating in today's call, all of your plates are incredibly full right now. And this call especially probably feels very heavy. Everything that we're talking about impacts the work that you do, the individuals, families, communities that you serve. In devastating ways. But I want to kind of hone in on the importance of you all participating and speaking up. Your being here participating in this call and speaking up, it matters. It may not feel like our voice as an individual or as a singular agency may not have that much impact. But if we're all speaking up collectively, I think we can move the needle. So this moment is reminding us that doing our job that we do on a day-to-day basis is actually not enough, that we have to truly support our communities, we have to speak up. So I think a lot of times when people hear the word advocacy, especially those in the nonprofit sector, I sometimes hear from folks that they may not feel qualified, or that it feels political, or that their boards may not want them to engage in advocacy. And I really want to be clear that you're probably already doing advocacy and not realizing it. Advocacy is simply speaking up. It's sharing the story of the work that you do, the impact of these proposed policies, how that will impact your work and the communities that you serve. It's using your voice to make sure that legislators understand, not just legislators, everyone, honestly, everyone kind of understands what your community needs. It can look like sharing a story with a legislator. It can be kind of explaining how some of these policies that are being proposed will impact your work or impact the people in your community. It can be signing on to a letter, posting on social media, encouraging your community to do the same. It is so much of, I think, what we're asking of folks today falls squarely under issue advocacy and education, honestly. And that's protected and allowed, and it's needed. You know better than anyone what the day-to-day reality is of what's happening in your community. You know who's falling through the cracks. You know which programs change lives, what needs to grow, what the gaps are. So you have something incredibly powerful. You have your truth. And speaking that truth is one of the most important things that we can do as nonprofit leaders. We're not just advocating for abstract policies. We need to put faces and names and urgency behind these issues. We want you all to say that this is important to my community, this is important to the people I serve, and we need to do more. Next slide. So yes, you can advocate. It is vital to your organization's mission. And like I said, you're already doing it. Next slide. So what is advocacy? I think right now advocacy is talking to our senators in the state. Call their offices, send them a letter. Let them know what is going on. But there's a lot more that you can be doing that is fairly low effort. So some of what you can be doing is just educating your community, sending an email with an action alert, posting on social media, talking with your staff, talking with your volunteers. Let them know this is happening. We want to change what's happening. And here's some tools to be able to do it. The great thing about this webinar is that we have really excellent policy experts on this call with direct action items that you can take with you and bring back to your organization, the people that you serve, to be like, here's direct actions that we can take. Invite people to walk alongside you in this. Next slide. Don't be afraid. Don't be afraid of speaking up. As I said earlier, as a nonprofit professional, it might feel like, some of this is not allowed, but it is allowed. It is allowed, and it should be encouraged. Maybe there is some limitations on lobbying, but those limitations just mean that we can't spend a significant amount of our time on it. That doesn't mean that we can't speak up on the issues that directly impact our work, and we should speak up on the issues that directly impact our work. So educate, like I said, talk, continue to share your stories. It's never too late to start, honestly. It may feel like, if you've never done this before, intimidating, but start with a small action and just continue to build on that. Right now, it feels like a very urgent moment. Like I said, it is a very urgent moment, but the advocacy never stops. We have to continue even beyond what happens with this reconciliation process. All right, next slide. Yeah, I kind of shared that. Next slide. And then, Yeah, I want to say, like, it's not you doing it on your own. We had, I think, 70 or 80 people on this call, which is tremendous. You are all working with dozens, maybe hundreds of people, thousands of people. We have reach. We need to start exercising that muscle. The more that we can do together in advocating for these issues that really honestly impact so many people, we can do so much more than we realize. We can't be afraid to speak up. Um, yeah. I think in this situation, we rely a lot at the Human Service Chamber of Franklin County, a lot on our members as experts. You are all doing incredible work. You have those stories, you have the data. Now it's time to share them. So be relational, tell your truth, right? Be consistent, continue to share that story over and over again. We can't stop doing this. When we speak up, we're not only advocating for our missions, we're advocating for people's dignity, safety, and well-being. And we have to continue making that connection. You don't have to do everything alone. You don't have to have all of the answers. You have a voice, and we have to start using it. That's all I've got. I think we can kind of move on from that. Ooh.
Great. Thank you so much, Bhumika. I am going to stop sharing my screen. I think a lot of information was shared today, and there's so much more to do. So we'll be making sure that we share all of the resources out with those who attended, those who registered. There'll be a webpage dedicated to it. In a minute, we're going to stop the recording just in case anyone has any messages they want to give kind of off the record or questions they want to ask that they don't want to have recorded, and give a moment for that. But I just want to plug that our chamber is having one in Cincinnati, in the Cincinnati area, Columbus area, and Cleveland area is really powerful. This is like the first time we've really come together in this way, but it won't be the last. We have another webinar on July 30th that is being hosted with G2G Consulting. The focus of this one will be more on what's in the state operating budget and advocacy tips as we pursue not just funding, but policy change and educating lawmakers on the issue. So there'll be a link coming into the chat to register for that as well, and we'll share information. But now we'll stop the recording and really offer the opportunity first to our presenters if there's anything else you want to share candidly with the audience, or if any of our audience members want to ask anything off the record, this is kind of the time to do so.